Hello and welcome to Basic Spanish for OT, PT, and SLP clinicians. My name is Juanita and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. I will leave a link on the channel. If you have a copy of your book, I'm going to invite you to turn to page 95, where today we will continue with basic questions and commands. If you don't have a copy of the book, you can feel free to follow along, but I encourage you to get a copy. It will make following along that much easier. As I said, I will put a link on the channel. And this time also, I'm just going to ask if you are enjoying these series of videos and you would like to get notification when more are uploaded, please hit the subscribe button. And if you like the videos, just hit like. I appreciate it. Thank you. So with that being said, vamos a empezar. On page 95, the first phrase is I am from, and I am from occupational therapy. So that's something that you really need to know how to say where you're from when you're walking into a patient's room so they know who you are. So I am from is soy de. Okay, so the first one is I am from occupational therapy. Soy de terapia ocupacional. Soy de terapia ocupacional. Soy de terapia ocupacional. The next one, I am from physical therapy. So you still have the soy de, but it's soy de terapia física. Soy de terapia física. Soy de terapia física. The next one, I'm going to actually give 3 different ways for our speech language pathologists when you're saying you are from speech therapy. So you can say what I put in the book, soy de terapia de lenguaje. Soy de terapia de lenguaje. Soy de terapia de lenguaje. The next one, lenguaje may be a little bit difficult to pronounce, so you can also say soy de terapia de habla. Soy de terapia de habla. Soy de terapia de habla. And lastly, you can also say soy de soy de logopedia. Soy de logopedia. Soy de logopedia. So that one doesn't need a terapia de. It's soy de logopedia. So either of the 3 of those would be understood that you are from speech therapy. The next one is a little wordy. So for the purposes of the video, I'm going to cut out a portion of that. What is being asked is I'm going to ask you to do a few things to check the muscles around your mouth. It's a little wordy, especially if you're just trying to communicate your thought. And sometimes the way we say things in English may be a little bit more wordier than the way it is said in Spanish and vice versa. So instead of doing all of that, you can just say, I'm going to check the muscles around your mouth. Okay, so voy a revisar los músculos alrededor de tu boca. Voy a revisar los músculos alrededor de tu boca. Last time. Voy a revisar los músculos alrededor de tu boca. All right. The next one is something that our occupational therapist and our physical therapist, our clinicians, we say a lot. I will say that because when we're helping a patient to stand up, sometimes you have to block their knees so they don't slip, their leg doesn't fall out from under them. Especially with our patients who are neuro. We say this a lot with our neuro patients. So how you say that, I'm going to block your feet. Te voy a bloquear los pies. Te voy a bloquear los pies. Last time. Te voy a bloquear los pies. The last one on page 95, I'm going to block your knees. So sometimes we're blocking their feet, sometimes we're blocking their knees, sometimes you're blocking both. So, te voy a bloquear las rodillas. Te voy a bloquear las rodillas. Te voy a bloquear las rodillas. So we are at the 6-minute mark, and I'm going to try to stick in there because I'm trying to keep the videos under 10 minutes. Do you know what I'm saying? So I'm going to repeat some of the things I just said and try to see if you can remember, you can understand, or you can know what I'm saying. So the first one, soy de terapia ocupacional. Te voy a bloquear las rodillas. Soy de terapia física. Te voy a bloquear los pies. Soy de terapia de lenguaje. Voy a revisar los músculos alrededor de tu boca. Soy de logopedia. Soy de terapia de habla. So we're at the 7-minute mark, and that's it for page 95. I'm trying to keep the videos very short. This way you can listen and repeat and learn, and listen and repeat and learn. So, gracias por venir, and I'll see you in the next video. Adios.